Hello, friends. Dave Bjork here, lung cancer survivor, patient advocate, and yes, I'm the research evangelist. And welcome to the Research Evangelist podcast, coming to you, as always, from just outside of Boston, Massachusetts. You know, the Greek meaning of evangelist is bringing the good news. And I like to think that I'm bringing the good news in cancer research and care by interviewing people in life sciences that are doing amazing work. I call them brilliant but not famous. And well, the not famous part is ironic because they're all well known and respected in their field by their peers and the communities that they serve. But my next door neighbor might not recognize their name. But they really are brilliant and committed to the work. And I love meeting these amazing people and sharing a little bit about them and the work they're doing, the things they're passionate about. And I believe in serendipity. So I hope some positive things will come from me sharing these stories with you and to the universe. So today I'm super excited to have on my show Dr. Joshua Bauml. Dr. Bauml is the lung cancer disease area stronghold leader at Johnson & Johnson Innovative Medicines, and we'll talk about that because that's an interesting title. He is responsible for the end-to-end lung cancer development at J&J Innovative Medicines, including mature assets like Rybrevant and lazertinib, as well as identifying new assets in early development and or partnerships. Josh received his undergraduate degree from Tufts University right here in the great state of Massachusetts, his MD and residency from the ICANN School at Mount Sinai, and his fellowship at UPenn, of course. So that's also my alma mater. So we have a lot in common. So, Josh, welcome to the program.
Thanks so much for having me.
It's great to see you, man. So let's start by having you. And I just realized this morning that you went to Tufts, which is amazing because that's a Boston school and it's a great
Yeah.
school. And but I know you're from New Jersey. But tell us about the young Josh Bauml. And I know you're from New Jersey, Monmouth County. So
Mhm.
tell us a little bit about your the young Josh Bauml.
Yeah. I was a little bit shorter than I am now, but I've been tall my whole life relative to my age. But interesting, I never really played sports of any kind, despite being very tall. I've always been told that I'm a waste of height. People kept saying, do you play basketball? And the issue was is that as I was growing, it was growing so fast. I had no idea where the end of my arm was, so that hand-eye coordination never really came into play. Um, I actually did drama and musical theater my whole childhood, and I was really focused on. I wanted to be a doctor since I was 9 years old, but the way my extracurricular was always theater. Um, and that was sort of I was always in two worlds as a result because it was just very different focus. I was very focused on school and learning and getting to my goal of being a physician, but also really enjoyed performance.
Wow, that's amazing. And you also told me, and of course, I spent some time in Red Bank, New Jersey, so I've been to Monmouth County
Hmm.
because that was my first job out of college was there. But you 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 told me that you wanted to be a doctor since you were 9 years old, but you're not the first physician in your family. I believe your wife is Dr. Baumel, and
Yes, my wife.
you
So I
said
was
that she's a
supposed to
year
be the
smarter
first.
than you.
Yeah, she's a year smarter than me, definitely. I was supposed to be the first doctor in my family, but we got married before she graduated medical school. So she became the first Dr. Baumel. And yeah, she's a year smarter than me. She's more than a year smarter than me, but but I'm just doing my best trying to keep up.
So when you were 9 years old, how did you determine that you wanted to be? Were there other people in your family that inspired you, or like how was it?
No, I mean, I think I really loved science since I was little, and I was really trying to think about how I could use that to help others. And it was something where I saw doctors. I went to see doctors, and I said, "Well, this looks like a really good job where you can help people and really help people who aren't feeling well." And that's what got me excited about it. And a lot of kids say that when they're little kids. I think the difference was that as I grew up, it just never really went away. And it just happened to be that it seemed to be a really good fit for me as I grew older.
It's really funny. Josh, when I was younger, I thought I wanted to be a doctor,
Hmm.
and I went to visit a friend who was in medical school at the University of Minnesota, and I went and they were working on a cadaver, and the whole thing just like I was like, I can't do this. I just can't.
Yeah.
I can't do
Well,
this.
it's interesting because when I was in gross anatomy in medical school, so at Mount Sinai, it's very unique because the anatomy lab is usually in the basement, right? Like it's usually far away. No one wants
Right?
to.
Yeah.
But at Mount Sinai, the anatomy lab is actually on the 13th floor of this building with a view of Central Park and the city skyline. It's pretty beautiful. Um, but still, that was not my happy place. That was not where I really enjoyed because I'm not as a physician as I've just never my hands are not my strength. And so I found that it was such an honor and such a gift that this human being had given for me to learn that everything that I had done, I felt like I'm not doing enough honor to this person who has made this gift. And so I enjoyed learning about anatomy, but the time in the lab was certainly not my expertise.
Well, I can definitely feel your humility, which I really appreciate. So I would love to have you tell us about your triple major,
Almost. I had to drop
philosophy,
my
drama, and
biology.
biology.
Yeah, I had
There's
to
a
drop
story
the
there.
bio major when I was accepted to medical school. Um,
But tell
so
us about the triple major, the philosophy, drama, and biology. And you mentioned, your interest in theater, but tell us about that major. That's really interesting to me.
yeah, so when I went to Tufts, I was, I've done theater my whole life. I said, okay, I can major in this. And philosophy, I really sort of fell into. And I just really loved sort of the mental gymnastics of going through a problem, really thinking about it from every possible angle. And it really was exciting. And then biology, I want to be a doctor. I said, okay, I'll be a bio major. And then I was accepted to Mount Sinai had this program called the Humanities and Medicine program, where they accept, at least at the time, they accepted, about 20 to 25 students from the country who are humanities, social science majors, guaranteed them admission to medical school, and then you don't take orgophysics or the MCATs. And they were trying to evaluate, really do a experiment and say, okay, these pre-med classes often eliminate people who want to be doctors because they say, I don't want to take organic chemistry or I don't want to do physics. And they said, well, if you take smart kids and you put them in medical school, how will they do? And so I was accepted to the program. I was very honored to be accepted. And I called the head of the program at the time and I said, I really like biology. I'm a triple major right now. Can I keep my bio major? And I remember very clearly she said, no, you have to drop your bio major. Why don't you do another play in the meantime? So two very interesting thing happens as a result of that. Actually, three. The first is I think I'm the only person alive who can say when I was accepted to medical school, I was forced to drop my biology major. I think that's a very unique statement. The second, I did direct a play, which was very fun. And the third was that I started taking bio classes pass fail just because I thought they were interesting. So I took human physiology in college pass fail. The entire course was filled with pre-meds. Like everyone there was pre-med, was very focused on their grade. And when I walked up with my pass fail paper, the professor looked at me like, aren't you going to medical school? I said, yeah, but I've already been accepted and I just want to focus on learning here. I'm not worried about the grade. Um, and that was a very unique experience. But I just really love learning, and the program, the humanities medicine program, gave me that real opportunity to explore my college experience, and then when I got to medical school, really dive into that.
That's a really interesting program because I know I'm when I spoke with David Carbone on my show, and he talked about he wanted to be a mechanical engineer, and he found medical school to be boring because it was like memorization. So talk to us about like this idea of like just taking smart people and putting them into medical school and not worrying about the organic chemistry stuff. Like my son Patrick, he got a degree in public health,
Mhm.
and he thought he wanted to be a doctor, and then he took organic chemistry, and he just like
Right.
was
And
turned off.
the real question to ask, right, is if you ask most physicians, how often do you use organic chemistry?
Right.
It's pretty rare. Now, the ironic thing is that in my current role, I actually do have to think about organic chemistry, but most treating physicians don't use organic chemistry in their day to day. So the whole principle of this program is to say, you know, what happens if we just take smart kids? And they published their findings, and the kids in the program consistently graduated top of the class. They went off to good residency programs. They have good careers. And it's, I think, a real head scratcher to say, well, how should we be doing this moving forward? And I believe Mount Sinai has expanded the program, that they've modified it somewhat, but that they are taking more students who are not the traditional path pre-med students and accepting them to med school.
So is that organic chemistry type class? Is that kind of like a a threshold or something that you have to like pass the pass the test to?
I think a lot of it's not limited to medicine, right? A lot of our academic career is built upon, in order to do this, you have to do this. To go
Yeah.
to this college, you have to take the SAT and you got to get a score of like blank. To go to medical school, to go to law school, whatever. We set these thresholds and it puts people into boxes. But I think that there are real opportunities to look beyond that and to just identify on a human basis who's going to be really good at doing a particular role. I think that the tests and the boxes help make it easier, but it's not perfect. And I think that that's what they found with this program.
Yeah, it's definitely not perfect. And of course, I went to the Wharton School of Penn, so I think there are a lot of boxes there too as well.
Yeah,
You know, going getting
of
through
course.
that, getting through that program. And speaking of Penn, I would love to have you tell us about one of the things I love the most about speaking with the doctors on my show is this idea of mentorship, and I think mentorship is just so brilliant. It's just so powerful because I think you have mentors and then you become a mentor to the next generation, right?
Mhm.
So tell us about some of your mentors. I know one in particular that I'm
Yeah.
excited to hear. You know who I'm talking about.
Yeah, no, of course. So, I mean, when I was at Penn, Corey Langer I mean, I would absolutely would not be where I am today without Corey's mentorship. I mean, Corey really took me under his wing, showed me how to do thoracic oncology clinically, how to do thoracic oncology research, how to collaborate with people. I mean, Corey's career is truly the quintessential example of collaboration. Just again, it's not dissimilar to the process by which I got into medical school, right? You take a really smart guy and you have him work with people. You can see his impact across the field for years and years, and we'll continue to see it because Corey is such a phenomenal mentor that there's a whole crew of his mentees that are affecting thoracic oncology research, not only around the country, but around the world. And it just was absolutely an honor to work with him and to learn from him. And I'm still learning from him today. It just really shapes the way that I see a mentor as also an advocate can be. I mean, yeah.
It's amazing. You know, my surgeon was Dr. Doug Mathieson,
Mhm.
and I've met so many thoracic oncologists, thoracic surgeons who trained under him.
Mhm.
And just the thought of like how blessed was I to like have Doug Mathieson as my surgeon. You know, he was the Corey Langer at
Mhm.
Mass General. You know, he was the man. He was just, And so many people look up to him, and I just really appreciate that. So I would love to hear, like, talk to us about, so you're a medical doctor, you're an medical oncologist,
Yeah.
you spent your time at Penn,
Yeah.
which I love. Talk to us about that transition from being an oncologist at Penn to coming to J&J Innovative Medicines.
Yeah, I mean, it was a big leap. And I think that the key element is that, Kevin Fox, who's used to lead the breast cancer program at Penn, said to us at the end of our fellowship, he said, in your academic career, there are three parts. There is your research, there's your clinical care, and there's your family. And you can be great at two of them. So pick your two. And
Mm.
so for me, my family has always been the most important thing in the world to me. Um, and everything that I do is centered around helping to support my family. And so when I was working as an oncologist at Penn, what I really developed a deep passion for was doing research. I enjoyed clinical medicine, but what really got me up in the day was designing new trials, bringing new trials to patients, and really changing the way that this disease is managed. And so I was doing that and finding some success in that role. Um, but I was working. One of the trials that I was running was with amivantamab. I was one of the first docs to be enrolling in a trial of amivantamab. And when J&J approached me and said, "Hey, would you help to lead the team that's developing amivantamab?" I said, "Well, I've got a drug here. I've seen the impact it has for patients. I've seen the potential of this drug. And so there's a huge opportunity for me to learn with the J&J team. And so it was a difficult decision, but it was one that was definitely the right decision for me because I had, I think, grown to the level of where I could be from the work that I was doing at Penn. And now at J&J, I'm learning something new every single day. And I've had such amazing opportunities at J&J because of their deep commitment to lung cancer and lung cancer treatment that I'm working with people at J&J who are every bit as passionate as I am about eradicating lung cancer. And that's just really, really exciting to be focused so intently on that.
That's really interesting, Josh. As I recently interviewed Biljana Namovic,
Hmm.
who's one of your colleagues,
Yeah.
and she told me about when she's also, of course, she's an oncologist as well, and she was treating patients in Serbia, and when she transferred to go to work in industry to Roche, she felt like the lack of resources and the impact that she felt that she was having as a medical doctor. When she got to her position in industry, she felt like it was like a thousandfold impact that she could have.
Oh, yeah.
Do you feel that? I know you probably miss
Absolutely.
seeing patients,
I
but do you
do.
feel that? Do you
I
feel that?
do. Yeah, I mean, like if you think about the fact, right? Just take one trial within the Rybrevant program. So we have the Mariposa trial. 1,074 patients were enrolled to that study. Okay, I have that number sort of off the top of my head. Uh, 1,074 patients enrolled. When I was in clinic and had a busy clinic day, I'd see 30 people and I could, support them and help them on a one-on-one basis, really that interpersonal interaction. But if we talk about the fact that, that's one trial, Mariposa 2 had around 600 patients in it. And then once you get from those trials, from positive trials to approvals, we're talking about thousands and thousands of people all around the world who you are impacting. And in academia and in clinical medicine, it's really a partnership. You are there to advocate for your patient. And you are there working as a team with your patient. And I really think that that's absolutely critical. But now that I'm at J&J, I don't just have myself and my team, my direct team. I have the whole organization of Johnson and Johnson behind us to try to move this forward to help patients around the world. And the impact of that is truly breathtaking. And it's really exciting to be a part of a team like that.
Yeah, I totally agree with you, and I felt it when Billy Allen was explaining it to me. It really made sense to me because it was like, and I know you're a caring doctor, and so I'm sure you probably, I'm sure there are times when you miss like seeing your patients and having those
Yeah, of
conversations,
course.
whatever. But the impact that you can have, and it's really why I have industry people on my show is that I want to make sure that people understand the impact that people like you can have uh, on so many people, right? It's
And the
so
other
important.
element is that you can bring that same personalized care that you would administer in practice and advocate for it on an industry level. So if I'm designing a trial, I can think about, hey, this adverse event is really important. This is something that really affects people's quality of life. How can we mitigate that and put the strength of the organization behind that as well? And you're seeing that in the trials that we're putting out for Rybrevant and Las Clues, where we're building in supportive care trials right off the bat to make sure that we're meeting people and helping them where they are.
Yeah, and I appreciate that. And by the way, just so my listeners know, I'm honored to be part of the steering committee on the Copernicus trial for J&J. So
Thanks so much.
it's my great honor to be part of that. Um, so I want to ask you. I mentioned it when we started that your title is Disease Area Stronghold Leader. Come
Yeah.
on, you got to tell us what is that? What is that?
Well, in industry, we like to have titles. We're big on names and words. When I first heard about Stronghold, somehow makes me think that I'm going to have a castle. I don't have a castle. The castle has not been given to me. I don't think I'm going to
You
get
need
one
the
either.
keys to the castle.
I need the keys to the castle in order to get the castle. In any case, basically the idea, I think a really good one, and many companies do this, is what we do at J&J is we say, okay, oncology is big. There's all sorts of cancers, all sorts of approaches. And if we really focus on everything, right? I say, I'm going to treat everything, we're going to develop drugs for everything, then we're going to be too diffuse. And so the idea here is to say, we want to build expertise in these areas. So, in lung cancer, in prostate cancer, in bladder cancer, in multiple myeloma, and B cell malignancies, we want to build expertise. And so, as the lung cancer disease area stronghold leader, it's my responsibility to help organize the strategy of what we're going to do in lung cancer. And I can lean on my experience of 10 years treating patients with lung cancer at Penn to help inform that strategy now with the infrastructure and resources of Johnson & Johnson Innovative Medicine behind me.
And all those amazing people like Biljana and Mark
That's
Wildgust
right.
and so many others who are so committed to this.
It's an amazing list. And the cool part about working in industry is you start to meet people who know a huge amount about something that I didn't even know was real before. Or like I didn't even know that it was real, but I didn't even know it existed. But that people have this level of expertise in this small area. That's how you have success, is having those brilliant people around you. I love walking into a room. I don't want to be the smartest person in the room ever. I want to be in a room with people who are much smarter than me. And I'm really happy that I get to do that every day.
I agree. I don't want to be the smartest person in the room either. And I love walking into a room with really smart people. But the other thing too is that you find that there's a lot of personal connections to lung cancer too,
Yeah.
on members of the team, which I think is really cool. So there's something, and again, I'm not just here pitching J&J, but I do love the culture at J&J, and I've been honored to work with very many people there. But again, I like to say that I'm trying to just humanize it for people to understand that there are a lot of amazing good people who are
Yeah.
trying to change patients' lives. It's not about the money, it's not about,
It,
right?
it really is. There's a lot of passion for eradicating cancer, and I've been, coming from industry, coming from academia, going to industry. You can be worried, like, well, what are these people going to be doing? What is their real drive? But at J&J, we have our credo, which really guides everything that we do to make sure that we are focused on helping patients, helping physicians really, and this goes back, years and years and years. There's not many people who have mission statements that are this old as the Johnson and Johnson credo. And so it really supports everything that we do. We have very passionate team members who want to eradicate these deadly diseases and help people around the world.
Yeah, and people who know me know I'm agnostic as well. Like I gave testimony at an ODAC meeting
Mhm.
for AstraZeneca. So, like, I think I'm here for patients, and I know that
Yep.
you guys are as well. And I hear that a lot from people, my pharma friends, who are like, even if a patient gets a treatment from a different pharma company, you're happy with that
Of
because they're
course.
getting the right treatment.
I want every patient to get the right treatment, and I want every
Exactly.
patient to do as well as humanly possible.
Exactly. 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 So,
But the other point is that I'm not happy to just accept the status quo, say this is where we are and this is where we'll have to be. I always want to keep striving to make those treatments better for people around the world.
and let's make sure that we get people access to those treatments. True, right?
Absolutely. If I make the best treatment in the world and no one has access to it, what's the point of that treatment?
Absolutely.
The goal here is to help change people's lives.
Yeah. And I mean, we could have a whole different conversation on that topic about getting people access to medicines that are, I was treated 25 years ago. I live a life of gratitude because I had early stage lung cancer, had a lobectomy. It was terrible, but you know what? There were not many options 25 years ago
Yeah.
for lung cancer patients. And look at what we have today,
Yep.
right? So, how do we make sure that people get access to those medicines because they're transformative,
Absolutely.
So, one of the things that you talked to me about when we first met, you were talking about the sort of communication with patients, the sort of the good news or the bad news. And when you think back to your time when you were treating patients, like I'm always interested in hearing, like how, as a medical oncologist, you sort of uh, car- how do you deal with those emotions of like delivering good news or bad news? Like Sharo Agarwal at Penn,
Hmm.
my friend Sharo, she said, that she never thought of it, but when she actually could deliver good news, it was something that she never really kind of thought of.
Hmm.
So, like, how do you, and maybe from your role at J&J, like, think about that communication with patients, about sort of the good news or the bad news. Do you know what I'm saying?
Yeah, no. So, I mean, when I was in practice, I mean, my view was always that I'm there to help the patient and their family. And so, whatever the patient and their family needs, that's what I wanted to provide. And I always aimed to do that. And when someone was receiving bad news, I've heard people say, oh, it's a rough day for the oncologist. It's a bad thing. They don't want to do it. And I think all that's true. But the big thing, which I always thought, is that, yeah, it's not easy for me to tell this person these bad news, but it's a lot harder for that person to receive that bad news.
Yeah.
So at the end of the day, it's not about me.
Not
It's
about
not,
you. Yeah.
it's
Yeah.
not about what sort of day I'm having. The goal here is to make sure that I'm supporting this patient and their family in every way possible. And I think that in much the same way within Johnson and Johnson, I'm the lung cancer disease area stronghold leader. But again, it's not about me.
It's
It's
not about
about
you. Yeah.
what our organization can do to help people and how can we as a team bring that to improve outcomes for this deadly disease?
Yeah. I love that. I love that. So, so Josh, tell us, tell us what research that you're most excited about.
Research I'm most excited about. Well, I'm really excited. So in my new role, coming from working on Rybrevant, now working on all of our lung cancer strategy, I'm just really excited about the fact that we can sit down and say, okay, here are all the types of lung cancer. Here are the types of treatments that we're seeing being developed. Here are the types of treatments that our scientists are identifying. And then bringing that forward. I'm just really excited to see in its infancy these early treatments that may be transformational, maybe the treatments of tomorrow. And that makes me really excited to come to work every day.
That's awesome. Because we all know that if the sooner we can detect lung cancer, the better outcomes we're going to have, right?
That's right. And I also think that I should say that while I'm excited about the treatments of tomorrow, I'm also enormously proud of the work that our team has generated in the last couple of years, bringing multiple phase 3 clinical trials to the market. And so I'm just really excited about what we've done because it shows the track record for success about what we can bring for tomorrow.
Yeah, you guys are having a good year. I'll
It's
just
been a
say
busy
that.
year. It's been a
But
busy year.
it's good for our community because AstraZeneca's had a good year too. So again, to me, I'm agnostic. It's not a competition. It's like we're all in this together,
That's right.
and I appreciate the passion that you bring. So I have to circle back to okay. So you were involved with theater when you were
Yes,
younger. You're a singer.
I am.
So has your synagogue been able to get you to sing or perform?
They've tried very hard. It has not been successful. What I've told my wife is, we have 4 boys and they're very busy. They've got a lot of stuff they're doing. And so when they do have a show coming up next year, they were advocating for me to try out for. And my wife said, "Why don't you do it?" I said, "Erica, we've got 4 kids. I work hard. You have a job. And it's like, you want me to add on to that I'm not in the house every night because I'm going to rehearsal. I don't think you're going to like that. I don't think it's going to go well." So the deal that we set is I said, okay, if any of the boys want to do a show, then I'll try out for that show. But if it's just, again, if it's about me and what I want to do, then I'd rather not. I'll do what my family needs.
I love that. You're so humble, man. It's not, you're always like, it's not about me, it's about others. And I really appreciate that. And I feel this, I'm the same way, but I have no talent in
I'm
that
sure that's
area.
not true. Here you are doing this. You got to have some talent, and
I,
you don't get to where you are in life without talent.
well, so, so my friend Jason Porter,
Uh huh.
Jason,
Of course.
he was talking about how he sings on his way home from work.
Hmm.
And then I heard that he actually had a scholarship to go to Ole Miss as a singer, which he
Hmm.
turned down because he wanted to stay in Memphis.
Yeah.
So you guys have talent. I have no talent in the singing area. I have
No,
no
maybe not
talent.
in the singing area, but it's. I will say that in my current role, even in my former role, there are very few musical numbers. So being able to sing is not terribly useful as an oncologist.
But it makes you interesting. I'll give you that. So I have to say that I could go on and on with you because you're such an interesting person, Josh. I really appreciate hanging out with you. But what I'd like to ask you, I always ask everybody at the end of my show, tell us something, and you've already mentioned the things you're passionate about, but tell us something that you're passionate about or that people may not know about you.
Something I'm passionate about, people may not know about me. Well, I mentioned before my I think many people who would be listening to this are aware of the work that I've done in lung cancer and my research. I mean, I think the thing that is most important to me is my family. And so that's the thing I'm most passionate about. How can I help my family and our four boys? Um, I spend a lot of time with them and my family, and that's really been the central linchpin of my life. I do most of the cooking in our house. I don't know if many people know that. So that's lots of things that keep us busy.
And how old are your kids?
So one of them just had a birthday. So 7, 11, 13, and 14.
Okay. So are any of these boys going to be future doctors?
It's tough to tell. My eldest claims he wants to be a doctor. But he's not as focused and committed to it. I think the issue is because Erica and I are both doctors. It's all he knows. So we'll see. We'll see what they end up doing. It's just a pleasure to be able to see them growing into human beings. So that's
Yeah,
really exciting.
I'm the same. I just love watching my kids. I have three boys, by the way. So
Oh, okay.
So I'm on the same track as you, and they're all doing great, and it's just really fun. It's interesting. The two of my boys actually are dating girls who are in medical school, which is kind of
Oh,
interesting. So one at Georgetown and one at Boston Medical Center. But it's just fun to watch them grow, right? It's just fun to
yeah.
watch them turning to, and you're like right behind me. Like it's just gonna get, Josh, it's just gonna get better. I'm telling you.
That's exciting.
They're going to go from high school, they're going to go into college, they're going to graduate, they're going to get jobs, they're going to be, and so it just keeps getting better. So anyway, Josh, thank you so much
Of
for what
course.
you do for the lung cancer community, and thank you so much for being on my show. I really appreciate it.
Thanks so much for having me. It's an honor to be here.